I was really pleased to be involved in the 1,000 Lives campaign because it was about implementing best practice. And like we've said, although we know what best practice is about, having that opportunity and empowering our staff to be able to do that was a great opportunity for me. The two areas that I was involved in was hair removal and the normothermia. What we found within the hair removal was there was inconsistencies within the trust. Although we were one trust, there was some hospitals had already implemented evidence-based practice, and there were other hospitals and wards that hadn't implemented it. So we obviously identified what wards hadn't implemented it, and we looked at changing that practice in that area, and we were very successful. The reason it's so important about using clippers or having hair removal performed in theatre is the fact that it reduces the risk of infection. Again, normothermia is really important. It's about reducing the risk of surgical complications and the risk of infections and other complications within surgery. So we have to make sure that the patient's temperature is within the normal range. Obviously, if a patient's temperature was below 36, then we need to, as a ward and as nurses, we need to inform people so that we can then make sure that we warm our patients prior to going to theatre. The ward manager is the driving force. She is the person that will, if anybody's going to implement the change, it's going to be her. It's how she approaches that change and how she sells it to our staff is really, really important. And it's about her reinforcing, but also giving them the information that they need in order that they will implement best practice. We need the patient safety campaign, 1,000 Lives, in order so that we can prevent harm to our patients. As we say, the campaign is about reducing deaths, avoidable deaths, and reducing harm to our patients.